Ellarikku Namaskaram. Good morning. Uh, Today it is indeed a privilege to be on this auspicious occasion of the International Patient Safety Conference. But part of the Dozee company group that we are here to unveil their new feature fall prevention. Now, in the last 1 year, we have had about 1.5 to 2 million falls among elderly population, with a staggering 50 to 60% resulting in fall-related injuries. It, as a physician consultant at Ramaya Memorial Hospital, we've had patients misfortune of having falls and causing increase in their hospital stay, financial burden, increased morbidity and mortality risks. Now, with the amazing technology offered by Dozee and the support of my healthcare staff, now we've had about zero falls, zero code blue deaths, creating a much better patient outcome. So there is a huge future, exciting future for us and for Dozee in creating the best patient atmosphere in our hospitals. So I congratulate the team of Dozee for this unveiling of the fall prevention technology that they are bringing out to our hospitals and our patients. Thank you.
Mudit, I am CEO and co-founder of Dozee. Today we are very glad to launch a very new feature called Fall Prevention Alert in Dozee. Dozee is a contactless remote patient monitor and AI-based early warning system focused towards enhancing the patient safety in every bed in a hospital, especially in non-ICU kind of a setup. So far, we were monitoring vitals of the patient to predict, how the patient is deteriorating and so on, right? And we had seen an amazing success in terms of reducing the code blues and also to reduce the other adverse event that happens in the hospital, right? Especially in outside ICU kind of a setting. And moving on, when we discussed with the clinicians that, what is next? How do we further enhance the patient safety? One of the first feature requests that came from them was to help them reduce the fall, because that is one of the most frequent adverse event that happens in a hospital. And because of that, right, unnecessary stay increases for patients, unnecessary costs are there. There are also mental and psychological, burden that comes both to the patient as well as to the family. And many of these falls are many a times also fatal as well, right? So therefore, we work together with the clinicians and our engineers to come up with this feature that, using different kind of static load sensors as well as, ballistocardiography sensing, we estimate, if the patient is in the bed or outside the bed. For the patients who are at very high risk of falls, they're elderly, or patients who are just gone through a knee surgery or gone through a procedure in which they were heavily sedated and things like that. So there is a scale called Morse score or JH modified scale. They are marked on that. And if we identify such a patient, right, if they come out of the bed without informing the nursing, Dozee gives an alert to the nursing team that, this patient has come out of their bed and go and attend to them as early as possible. So nurses watching that quickly rush to the patient and ensure that, they are not going alone to restroom or wherever, because that's exactly where maximum amount of falls do happen. So it's a preventative feature which ensures that, the falls in the hospitals are reduced, and so that, we can reduce the burden, cost burden, psychological burden, and so on, and make the safe care even safer, right, and improve the patient safety in every bed, right? So that's what in a nutshell is fall prevention alert that has been just launched by Dozee. Thank you.